What is colorectal cancer by me, Mario Castro? All right, a little background on why I decided to talk about this disease. As you can see, I have a picture of a lovely grandma. Not my grandma, but lovely grandma. A couple years ago, my grandma, who lives in Mexico, was diagnosed with cancer. She was started feeling a little bit uncomfortable, but like most Hispanics and family members that I know, once they start feeling a little bit ill, they decide to try to do things the natural way through herbs, or sometimes just completely ignore the situation. And things started progressing to where my grandma was not feeling well. She was feeling lots of pain. Eventually, she did go to, she went to the doctor's. And so what happened was that they told her that she had she had cancer. She had cancer in her colon, and um, like anyone who hears those words, she was very freaked out. Um, she was scared, but eventually, they convinced her to go ahead and get medication, get her treatment. Initially, she did not want to, because she felt that she had lived a full life, but she was still um, 62 at the time, and she had a total of 10 children, 10 kids, which is, yeah, a lot of kids. But they told her, you know what? No, we still need you. Go ahead and we need you to fight. And so they encouraged her to go ahead and seek treatment. She ended up having to go under the knife. She got surgery in which um, they cut out the cancer. And so she had a colostomy bag, in which just a little bit of description on what that is they take your colon, your intestine, and it's actually your rectum, and you now have to poop out of the side of your stomach. So they make it to where you no longer poop. Your poop comes out. Your poop comes out into a little bag on the side, hidden. Um, and that's how she was for the remainder of her life. She ended up having to. Did They told her that she only had approximately about 6 months after, about approximately 6 months later, she went back, and so they told her that the cancer was back, and so they gave her about 6 months. Long story short, she ended up surviving for another 3 years, and um, I got to see her before she got sick, and that was my last. Everything else was over the phone, because once she got the surgery, she wasn't able to move as much, and as the disease progressed, she was bedridden. Um, her body was in constant pain, and she was taking all her medications, so she she was laying down, basically trying to recover as best as she could. At the end, they just kind of made her feel as comfortable as possible, and so she ended up passing away. But that's the reason why I decided to look into this disease. It's always been in the back of my mind, because, as most people know, that cancer is something that can potentially run in the family. There's higher risks, and so we'll be talking a little bit more about that as we go on in the presentation. But this is something that I felt could, in some way, affect me, and so um, this is why we're looking into it. So continuing on, um, I have a picture here on what the colon looks like. Um, So it's coming off the small intestine here, and so we'll just go ahead. So what is colorectal cancer? So it's a cancer that begins in the colon. It's called colorectal cancer. While cancer that starts in the rectum is known as rectal cancer. Cancers that affect either these organs may be called colorectal cancer. That's kind of where it comes in. They put both of those words together. Um, Even though it's not true in all cases, the majority of the colorectal cancers generally develop over time from adenomatous polyps or precancerous polyps. Well, polyp is it's a growth um, that obviously grows. Could be like a little lump, something abnormal that's growing in the area. These polyps can change after a series of mutations um, due to changes in their cellular DNA. Some of the risk factors for colorectal cancer involve family history of colon or rectal cancer, diet, alcohol intake, smoking, and inflammatory bowel disease, which we'll go a little bit further in later on. So, what parts of the body are affected by colorectal cancer? Kind of a little bit what we talked about, the colon. To go a little bit more in depth on what the colon is, it is approximately a 5 to 6 foot long tube that connects the small intestine to the rectum. Um, the colon, which along with the rectum is called the large intestine. So those two parts together, large intestine. It moves and processes digesting food across the body and down towards the rectum, and then it empties out or exits the body as stool. The parts of the colon include the ascending colon, the transverse colon, descending colon, and sigmoid colon. As you can see, the different parts described and depicted in the picture. The rectum is a 5 to 6 inch chamber that connects the colon to the anus, and essentially, the rectum acts as a storage unit and holds the stool until uh, the body expels it. So, how does colorectal cancer develop, you may ask? All of the body's cells normally grow, divide, and die in order to keep the body healthy, functioning properly. But there are times when this process does not work the way it should. So the cells keep growing, dividing, even when they're supposed to die. Um, the cells lining the colon and rectum multiply um, uncontrollably, and that's where colorectal cancer ends up developing. Most colorectal cancers, though, they begin as small precancerous polyps, um, and then these symptoms they grow slowly, and they don't cause any symptoms until they're large and cancerous. Um, so this is beneficial because it allows for the opportunity to identify these polyps at an earlier stage where they may be um, removed and ultimately save the person's life. So with regarding these polyps, there's different types of them, um, but cancer is thought to come about from some called adenomas and sessile serrated lesions, which are the precancerous polyps. Um, if a polyp is found during a colonoscopy, usually it is removed if that's something that's possible. These polyps are then examined by a pathologist and evaluated to determine if they contain these cancers or precancerous cells. So, based on this, the number, size, type of precancerous polyps during a coloscopy, uh, the doctor may recommend another one just to start keeping an eye, keeping track of the patient's colon. All right, moving on. There's several risk factors. Some of them can be controlled, while others are just simply life. And so we'll go ahead and go through those. As you can see, age is one of them. No one can control age; it's just something of life. But cases are increasing in people younger than age 64 and increasing faster for those younger than 50. Um, so it's always good to keep educating people on what they need to be looking for if there's any symptoms, which we'll go a little bit more in depth later on. According to the Centers for Disease Control and Prevention, about 90% of colorectal cancers cases are in people age 50 or older. So that's the main concern. Um, Race and ethnicity, another thing that is out of everyone's control, essentially. Um, Colorectal cancer diagnosis and death are higher among non Hispanic African Americans. Those rates are also higher in American Indians, Alaska Natives, and Jewish people of Eastern and Central European descent. Um, if you have a history of polyps or cancer, or if there is a history, again, something that's out of the patient's control. So the risk is higher for those who have previously had colorectal polyps, um, especially if they were large, copious, or abnormal but non-cancerous cells. Um, the risk is also higher for a patient who's had colorectal cancer before. Um, Certain health conditions, such as inflammatory bowel disease, type 2 diabetes, may rise in risk for developing this cancer. Uh, Irritable bowel syndrome um, doesn't seem to be linked to a high risk. Um, Certain genetic syndromes. So, having an inherited condition raises the risk of this type of cancer, such as uh, Lynch syndrome. Um, Research are studying whether gene mutations linked to breast cancer may increase potential risk of colorectal cancer. Um, and ultimately, a family health history. So, if there's been somebody else who has had colorectal cancer, the risk of you obtaining it is higher. As far as factors that you can control, the diet is definitely something because the risk is higher for those who eat high fat diet, a lot of processed meat or red meat. So the goal is to look for foods that are rich in fruits, vegetables, and fiber. For those who drink, moderate to heavy alcohol consumption, sometimes even light to moderate drinking, it may raise the risk of colorectal cancer. It is recommended, according to the American Cancer Society, um, that men should limit themselves to 2 drinks a day and women to 1 drink a day, which I'm sure we all know people that drink a lot more than this. Your weight, the risk for colorectal cancer is higher for people who are overweight or obese, especially in men. The level of activity for those who uh, so there's a connection between physical activity and colon cancer, but not rectal cancer. So people who spend a lot of time sitting or lying down may be more likely to develop colorectal cancer. Um, According to the American Cancer Society, smoking um, is said that about 12% of the U.S. colorectal cancers are caused by current or former smoking. And lastly, preventative medications. So taking aspirin or other non-steroidal anti-inflammatory drugs, so NSAIDs, regularly for a long period have been shown to decrease uh, the risk of colorectal cancer, especially for people younger than 70 who are at healthy weights. So people should talk to their doctor to see what is ultimately um, best for them, see what they can do, because this is definitely something that if you can avoid, why put yourself at risk? Um, okay, let me just double check here. All right. So we're looking at the pathophysiology. We're looking at the behavior of these epithelial cells, and things to look out for definitely. Um, so the environment and genetic factors that cause colorectal cancer do so by promoting the behaviors, um, basically the behaviors of this cancer in these colon epithelial cells. Um, One of the ways these traits are acquired is through progressive accumulation of genetic and epigenetic alterations that activate oncogenes and inactive tumor suppression genes. A lot of medical talk here, but trying to understanding the reason why these polyps end up forming, and it's due to these um, epithelial cells. Um, the inactive tumor suppressive cells are analyzed, and seeing what it is that is causing these cells to turn around and start multiplying in such a way that um, can exponentially increase the division rate um, that causes the polyps. As we can also see here, 10% of these polyps that are seen are progress to cancer. So even though someone goes to the doctor for like a check, and so the doctor determines that there are polyps there, it is cause for concern. But again, 10% of those polyps, um, there's still very good odds that they might just be like a small tumor, or otherwise, in which they don't lead to being cancer. All right. So signs and symptoms. We got a picture here that says what common causes of blood and stool. A little bit kind of veering off, but as you can see, one of the reasons, as you can see, colon polyps, amongst other things, but colon cancer is also one of the reasons. So looking into so colon and rectal cancers do not produce symptoms in the early stages of the disease. As the tumor grows, symptoms will depend on the location of the primary tumor within the intestine. Patients with colon cancer and rectal cancer may experience one or multiple symptoms, one of them being blood in the stool. So you may notice the blood in the stool or darker colored bowel movements, which indicate that there is bleeding within the intestinal tract or rectum. Sometimes bleeding may be present but not visible. It's called occult blood and may not be discovered until a blood test indicates low red blood cell count. So rectal bleeding as well as bright red blood in the stool typically indicates that there's bleeding in the rectum or colon. And this, as we were talking about, may be a sign of colon or rectal cancer. Rectal bleeding can be caused by hemorrhoids. Um, Typically, state patients with hemorrhoids experience symptoms that come and go with flare-ups, whereas rectal bleeding caused by cancer usually continues or worsens, and it is accompanied by pain. Um, some of the signs, as well as changes in the bowel's habit. Changes in bowel's habit can indicate colon or rectal cancer. um, which includes new onset constipation or diarrhea, changes in frequency and size and caliber of bowel movements, uh, a bowel that doesn't seem to empty completely, and stool is narrower than normal, sometimes even as thin as a pencil. Uh, Occasionally, these bowel changes can be caused by a dietary change, disagreeable food, or some type of viral bacterial infection. Um, but if there's something new and explained and it lasts for several days, a doctor should be seen. Um, the next one is abdominal pain and bloating. So, stomach bloating, distension, cramps, or pain in the abdominal or bowel region can be symptoms of colon or rectal cancer. These are common issues that can also be caused by a number of other conditions, such as diet related, Crohn's disease, or ulcerative colitis. Again, the doctor should be seen if there's um, no obvious cause for feeling this way. Um, Anemia, which is a blood disorder, and it's categorized by deficiency of red blood cells or hemoglobin. So, in patients with colon or rectal cancer, intestinal bleeding may cause anemia. Depending on the location of the bleeding within the colon, anemia can be the first sign that blood loss is occurring. Um, Let me see. And another reason, pelvic pain. So, pain in the pelvic area is not common in patients with colon or rectal cancer, but if it occurs, it may indicate that the cancer has spread to the pelvic area. So, what are the stages? For this treatment, it's not like one of those one injection cures all type of deal. This is kind of like a two for one because there's a picture here of what the stages of colon cancer are, but this is just the picture just kind of depict what we're looking at versus what we're also going to be talking about is the stages of treatment of cancer. Um, so and it's the treatment for colon cancer is based largely on the extent of the cancer, but there are other factors that are important. So people with colon cancers that have not spread to distant sites, in which the cancer hasn't spread to different sites, um, usually have surgery as a first treatment. Chemotherapy may use after the surgery, um, and most treatment is given for about 6 months or so. So, stage zero of colon cancer. In stage zero, cancers have not grown beyond the inner lining of the colon. Um, and so, surgery is used to take out the cancer and often the only treatment needed. But in most cases, it can be done by removing the polyp or taking out the area of cancer uh, through like a colonoscopy. Uh, Removing part of the colon, so a partial colectomy may be needed if a cancer is too big to be removed by local incision. In stage one colon cancer, uh, the cancers have grown deeper into the layers of the colon wall, but have not spread outside of the colon wall itself into nearby lymph nodes. Um, in stage one, uh, cancers that so stage one includes cancers that were part of a polyp. If the polyp is removed completely during a colonoscopy with no cancer cells at the edges uh, of the removed piece, no treatment may be needed. Um, Going a little bit into stage two colon cancers have grown through the wall of the colon and into nearby tissue, but they have not spread into lymph nodes. So surgery is used to remove the colon containing the cancer, which is a partial colectomy, along with nearby lymph nodes. Um, and they do that just to be on the safe side. And in case they miss the cancer spreading, they want to just double check and just go a little bit further. Better be safe than sorry in these instances. For stage 3 colon cancer, the colon cancer has spread to nearby lymph nodes, but not other parts of the body. So again, surgery to remove the section of the colon with the cancer, partial colectomy, along with nearby lymph nodes, followed by uh, adjuvant chemo is a standard treatment for this stage. And then lastly, stage 4 colon cancers. They have spread from the colon to distant organs and tissues. Colon cancer is most often spreads to the liver, but can also spread to other places like the lung, brain, uh, peritoneum, which is the lining of the abdominal cavity, or to distant lymph nodes. In this particular case, surgery is unlikely to cure these cancers, uh, but if there are only a few areas of cancer spread in liver or lungs, they may be removed along with colon cancer. Surgery may help person live longer. Um, so in my grandma's case, she initially she did have surgery, and if I remember correctly, she was a stage 3. Um, so they ended up taking um, her colon. They didn't just take part of it; they took the entire thing in the affected area. What ended up essentially killing her, because so when she had her bag, she got better for some time, and she was up and about doing her business. It wasn't until it spread, it ended up spreading up to the rest of her body, um, which was very painful for her and couldn't get out of bed. So that's what caused ultimately for her to die. They couldn't um, take it all out, um, because then I mean, there's only so much of a person's body that you can cut out before the body starts shutting down and not functioning the way it's supposed to. Uh, for local reoccurrence, if the cancer comes back locally, um, surgery and then often followed by chemo can sometimes help you live longer. It may even cure you. If cancer can't be removed surgically, chemo might be tried at first, and then if it shrinks the tumor, then surgery might be an option, and then followed by more chemo. Um, in the event that it reoccurs um, years after, uh, so if the cancer comes back in a distant site, it is most likely to appear in the liver first. Um, Surgery might be an option for some people, but if not, tried. If not, chemo may be tried to shrink the tumors, which may be followed with surgery to remove them. Ablation or embolization techniques might be an option to treat some liver tumors. If the cancer has spread too much to be treated with surgery, chemo, and other targeted therapies, um, because then at that point, it's different. Once you get to stage 4, everything has progressed to where the hands of the doctors are tied, and so there's only so certain things that they can try in order to help the patient at that point. Um, Clinical trials may be another thing that can be tried, um, to see if newer treatments are available and what it is that medicine is new medicine is breaking into, pushing those barriers. We started looking at uh, the screening. So what is screening? So screening test is what is used for to look for disease when a person doesn't have symptoms. Um, so colorectal cancer usually develops from precancerous polyps in the colon or rectum, and these screening tests can find these precancerous polyps so that they can be removed before they turn into cancer. Um, the recommendations for screening is beginning at age 45. And this is key because it allows um, for early detection. So the U.S. Preventative Services Task Force uh, recommends that adults from 45 to 75 be screened for colorectal cancer. The task force recommends that adults age 76 to 85 talk to their doctors about screening. Um, the task force recommends um, several colorectal cancer screening strategies such as stool test, flexible, excuse me, sigmoidoscopy, colonoscopy, and colonography, which is a virtual colonoscopy. So there are different ways and um, different tests that could be taken if one for whatever reason is not working. Um, so 45 is usually the age that is really recommended, but it's encouraged for other people. 45 is normally like the average um, age for anyone with no issues, but there are other people um, if they have IBS, inflammatory bowel disease, um, such as Crohn's disease or ulcerative colitis. If there is a personal or family history of colorectal cancer or polyps, um, these are some of the external reasons why people should be um, getting checked up even more than what is recommended because there's a very high risk chance that they might develop uh, cancer in the colon or their rectum. So I did not know this. Through research, I found out that March is Colorectal Cancer Awareness Month. Um, so awareness is clearly the one of the ways in which people may be able to find out exactly what colorectal cancer is. It is definitely a cancer that could be uh, not necessarily prevented, but caught early if screening is done. Um, most in my culture, Hispanic culture, they're very male. Uh, there's a lot of high egos within the male community to where uh, they say, "Oh, you know what? I will never go to the doctor and bend over the table and get myself checked because of the risk of their manlyhood or whatever the case is." But um, in my case, it is something that because my grandma had it, we're not really sure if it's something that my dad has it. But at the certain age, like my dad ended up going when he was 40 to get checked, and every few years after that he goes just to because he's aware that because this is something that runs in the family. Um, it's something that he might develop again if caught early. There definitely is a very high chance um, for survival. Now, education and awareness is key because if people don't know that they need to be checked, especially if there's a family history or some of the described risks that we talked about earlier, there is a very high chance that by the time someone isn't feeling well and they go to the doctor, um, they might it might be too late. And definitely the goal here is to be able to help out as many people as possible. Um, and some of the a little bit of some statistics between 2000 and 2014. The death rates for colorectal cancer dropped 34% among patients 50 and older by continuing the spread to spread the word about the importance of regular screenings. Um, and as the more awareness this gets, as more awareness rises, the goal is to reduce the number of deaths, always closer to zero. Here are my references. Thank you so much for listening. Have a good one, guys.